Well, as families gather for the holidays, concerns about a so-called tripledemic continue to loom. Across the country, cases of COVID, flu, and RSV are surging and overwhelming some hospitals. And the FDA says we can expect shortages of antiviral medication and antibiotics to continue this flu and cold season. I'm joined now by Dr. Kavita Patel, former White House policy director to President Obama and an NBC News medical contributor. Dr. Patel, so good to see you. Thanks for being here.
Thanks so much, Kristen.
So just set the scene for us. How concerned are doctors? How concerned is the medical community right now about this so-called tripledemic?
Yeah, it's pretty concerning, and it's been concerning for several weeks, especially in children's hospitals. Almost every children's hospital in the country is either at or over capacity. In fact, pediatricians sent an urgent plea to the Biden administration last week asking for a specific public health emergency because of what they're seeing. And if it gets worse, that just means that we're straining not only the healthcare system, but Kristen, think about the downstream effect. These are parents who can't go to work. They've got to take care of their children, schools that won't have those children attending because they're sick and so on. And so you can just imagine that this could get a lot worse before it gets better.
Yeah, the ripple effect is potentially staggering. Dr. Patel, are any of the three viruses that we just talked about, COVID, RSV, and the flu, are any of those three showing signs that they may have peaked at this point?
Yeah, and so the interesting thing about RSV and flu, and actually COVID, Kristen, as you've been covering for several years now, is that we see this regional pattern, and that is definitely true with all three of the viruses causing the tripledemic. We're seeing a peak and even a decline in the Mid-Atlantic and Northeast for RSV specifically, and flu is starting to pick up in many parts of the country, the Southeast, Southwest, Mid-Atlantic, Northeast. So we're seeing a little bit of these varying paces. Of course, travel. People are going all over the country, so that could change that regionality a little bit, but I do think that hopefully, fingers crossed, we will get through the season. And it's just another reminder, if you haven't gotten your flu shot, if you haven't been up to date on your COVID shots, it's never too late, and you can get that done now.
Yeah, really important reminder. And of course, we do have vaccines you can get for the flu and COVID, but not yet RSV. Is there anything, I mean, a parent like myself, this is what I'm most concerned about. Are there any steps that parents can take to try to prevent their kids from getting RSV?
Yeah, an interesting point and something we've forgotten. If you recall, in early 2020, Kristen, we were all, or many of us, myself included, were wiping down counters and surfaces and packages because we weren't so sure about the majority of transmission of COVID, and we thought it could be on surfaces. Well, RSV really is what we call a fomite transmission, meaning touching things. So you touch your nose, touch your mouth, cough into your mouth, and you touch a counter, and it can live on surfaces for hours. So one thing to just do is if you've got someone sick in your household, do make sure that you're sanitizing, washing hands, using a mask where you can, especially adults. And then, of course, kids, I know they're all drippy, my own kids included, drippy, and they're just kind of all leaking everywhere. Just making sure you wipe surfaces down, doorknobs. Think about the things that people are commonly touching, especially during a holiday season with a packed house. That can minimize the transmission.
And Dr. Patel, one question I think that so many parents have, if your child does contract any of these three viruses, how do you know when it is time to go to the emergency room?
You know, I always tell my patients that a parent's instinct is the knowledge of when it's time, but especially if you see temperatures that, if you're concerned about a temperature, a fever, for example, that is not able to come down with Tylenol or a fever reliever medication. And of course, don't be afraid to pick up and call your local pediatrician, the nurses, they're all available 24/7, even on call. And then if you see especially a child that's struggling to breathe, that they're using their neck muscles to breathe, they're using their stomach muscles to breathe, that means they're just not able to kind of use their lungs more efficiently, and they're having a hard time getting oxygen in. And then also any fussy, not sleeping, kind of the lack of signs. They're not necessarily eating. Those are all, if your little instinct, as any parent has, goes off, listen to it and push, because we're seeing so many things happening right now around in hospitals and ERs.
All right, Dr. Kavita Patel, such important information. Thank you very much.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.